Tonight's speaker is a dear friend and avid supporter of Wild Med Wednesday from the very beginning, Dr. Glenn Barnes. Always a crowd favorite. It seems like we can't host enough talks with him because he's such a hit and such a fabulous educator as well. Dr. Glenn Barnes is a doctor of nursing practice with over 30 years experience in emergency, trauma, emergency preparedness, weapons of mass destruction, survival, executive protection, and emergency response. His background includes over 28 years of military service, having served in both the Army and the Navy. He's a former U.S. Army Green Beret who's returned to military service in the Navy Nurse Corps after the events of 9/11. And with his background, he was selected to lead a joint task force team to train federal law enforcement in emergency response for 2 years. Lieutenant Commander Barnes then deployed on Operation Iraqi Freedom and Enduring Freedom and was the officer in charge of the largest outlying clinic just south of the Iraqi border. Post-deployment, he began a career as a private military contractor working in counter-narcotics in Afghanistan, diplomatic protection in Iraq, and a year as the senior nurse mentor to the Ministry of Interior of Afghanistan. He then returned to the U.S. and began a career in academia, earning his doctorate in nurse practitioning with a focus on pathogen response. He's an associate professor of nursing at the University of Texas A&M, where he's the program coordinator for aerospace and extreme environment nursing. And he's an international speaker and consultant and a fellow in the Academy of Wilderness Medicine. In addition to a long list of many other credentials and accomplishments, I decided to cut the list short there. Welcome back, Dr. Barnes, and with that, I will turn our evening over to you.
Oh, thank you very much. I mean, what do you say after an intro like that? I'm a Scorpio. I enjoy long walks on the beach. Thank you. Yeah, let's get this program started here, guys. And because I'm from A&M, howdy, y'all. And I am with the College of Nursing. And there's all the bona fides as far as initials and stuff go. My fiance is repeatedly accused me of collecting initials, and I think she may be right. I may need an intervention. And this pretty much just everything that was already said about my background. Now, why do I put all this out there? It's for you guys to really listen to a speaker. You really want to know that that person has a background that says, hey, I have a background to listen to. So I do this not to brag or boast or anything like that, just to let you know that I do have a wealth of experience, and I've led a very, very blessed life. And right now I'm at that point in my life where all I want to do is take all those knowledge and experiences that I've had and share those with others, which is why I got into academia. All right. So as I said, I'm the program coordinator for this new program that A&M's putting on, and it's extreme environment nursing. And it's like, why A&M and why extreme environment? Well, A&M is a big hitter. They come in with strong financial, political support. They thrive on cutting edge technology, processes, and ideas. And right now, nurses are not where they can do the most good. So because I'm a nurse, I really want to push that nursing venue, not saying anything about any other discipline, because we all have our place. It's just that this is my drum and I'm going to beat it. That nurses can go out and be there to provide that post-incident. So with most physicians, they diagnose and initiate treatment, which is perfect. That's what they do. That's their job. Nurses come in afterwards, and they're the ones that provide the care and for that period afterwards. So many times, if you look at our text, they'll say, you find this patient, you assess them for these symptoms, and you provide this treatment, period. And then it stops. So, okay, well, what about and then? And that's where nursing comes in. So that's where I've spent most of my life, is developing these aspects. And there's some other works being done out there that are awesome, like the prolonged casualty care folks. They are just really doing a lot of super stuff, and they're coming from a special operations background. If you have a desire to get into any of that post-incident long-term care, please, please, please go check out. It's either prolonged field care or prolonged casualty care. They're almost synonymous terms, but one's more military and one is more civilian minded. They have an excellent podcast, and it's just a great, great group of people. Now, when we say extreme environments, what are we looking at? Well, we've categorized them into aerospace. And when we say aerospace, we're looking more at the space and less at the aero. Right now, there's a lot of aerospace nursing programs out there, but they're all really just aeromedical transport. And we're combining space and maritime because there you're dealing with pressure and oxygen or atmosphere. We combine Arctic and Alpine, so we have high altitude and extreme cold weather, desert and tropical, so we have our heat, dry heat and wet heat, and disasters and low intensity conflicts, because there we're dealing with the human element. And so those are our three main focus areas that they can go on to. But that's our overview. We're here to talk about space nursing. I know I haven't come up with a better word for that yet, but right now, that's what we're running with. And why space nursing? Why are we going to need nurses in space? Well, if you look at right now, the model for healthcare is a concierge model of care where you have one doctor and 4 or 5 people that are relatively healthy. I mean, bar William Shatner, but other than that, relatively healthy people. So it is really just concierge medicine, but with the privatization and potential for mining and other operations, plus using the moon as a launch pad to Mars, we're going to have an increase in people in space and on the moon, and eventually Mars. We're going to have more people, more moving parts, and people are going to get hurt. They're going to get sick. And it's not like you just put them in a cab and send them home. So we have all of that going on, and we're looking at future trends. So the ISS is slated to be brought back to Earth and allowed to disperse and burn up, hopefully in orbit or from orbit by about 2030. It's hard to realize 2030 is only about 4.5 years away. Holy crap. It boggles my mind that 2030 is just around the corner. And so we're trying to figure out, well, what happens when the ISS comes down? Well, NASA's like saying, hey, there's a lot of commercial people that want to put a platform, orbiting platform up there. Now, whether it orbits the Earth or whether it orbits the moon to support future moon-based operations, we're not so sure yet. But NASA's actually working on the idea of developing with private sectors to build these things. Now, I'm not saying we're going to end up with blocks in paradise for anybody that's a Fifth Element fan, but we are probably going to see. Right now, we already have celebrities that go up and they hang out and then they come back down. Wow, I'm an astronaut. Eventually, people are going to want to spend more time up there. So when you go up there, you spend more time. That's when I'm thinking we're going to start seeing the need for medical care that's up there. And then as they start building operations and mining and all this other stuff, we're going to see rotations. I'm figuring about every 30 days because of the effects on the human body from that. And then once we start figuring out that we want to go to Mars, then there's a whole new deal on there. Right now, they're planning a Mars mission will be a 3-year mission. And so if you're dealing with a 3-year mission, it's 9 months transit and then back and forth, and then 2 to 2.5 years, or they might go the whole full 3 years on planet. And that has a whole new bit. But at that point, we absolutely will be needing a form of long-term healthcare and change that model of healthcare from the concierge model to a more primary healthcare where you have physicians and mid-level providers giving the diagnosis and treatment allocations, and then nurses and other ancillary healthcare actually providing the care. Also from NASA. they're looking at, they already have these things planned out. They're just looking at when and who's going to be the prime. I think we all know who the prime people are going to be, but we're gearing for this with the idea of exploring Mars. Now, we all, if you've seen the movie The Martian, it's pretty accurate to what we know is the atmosphere and the weather and stuff on Mars. So I don't think we're going to see a building or a setup like what we've seen. I think we're going to see stuff in Mars. I think the only way to survive the radiation and the weather and everything is to be subterranean. So now we're talking drilling in network tunnels and overhangs and um, caverns that can then have a environment set up inside there, protected from the winds, solar radiation, and all the other bad things that are on the surface. That's just my personal idea, but it makes sense to me. Now, let's look at some fun facts here. So the Earth gravity, we're going to use that as our norm. Our gravity is made by the spinning rotation of the Earth, and it's 9.8 meters per second squared. Our air, yeah, 78% nitrogen, 21 oxygen, and an extra 1% of just extra stuff. Now, the important part is our pressure is 14.7. Now, in space, gravity, nope. Air, nope. Pressure, the moon is 16% of our gravity. Now, the atmosphere on the moon, very, very thin. It is so thin that the pressure on there is 1.5 times 10 to the negative 15. So barely there. And what's there is helium, hydrogen, neon, and argon. Not real useful for us. Now we go to Mars. Mars is a third of our gravity. Air, primarily CO2, but that's within the realm. We could work with that. And then a little bit of nitrogen, argon. The pressure, however, because it doesn't have an atmosphere, is 0.08 psi. So we're still not survivable on there because it just doesn't have a thick enough atmosphere. And we have to look at solar or cosmic radiation. There is nothing protecting you in there because for us, it's our atmosphere that protects us from those cosmic rays. In space or on these other, the moon or Mars, you got nothing. So the effects of that, long-term effects on that, well documented. We're just going to end up with having to find a better type of shielding. And they're coming out with some fabulous stuff. I was at a conference where they have a flexible material that they're actually making suits out of that can deflect 100% ionizing radiation. It was incredible. So now the implications of all this. Everybody's system is going to be affected from lower or no gravity. You also have space-associated neuroocular syndrome, which causes swelling in the back of the eye. That's one of those things. Every astronaut comes back with ocular changes. And this is going to have to be one of those things that we figure out how to fix before we can do any long-term missions. And then again, like I said, the ionizing radiation. Then we have psychological effects. We have the desocialization, the isolation, the boredom, stress, and fear. And it's a lot like when people go to isolated research facilities or if you're incarcerated or on military deployment, which is kind of tongue in cheek, but if you've ever been on a military deployment, it's not far from incarceration. All right, Reader's Digest version from the microgravity and radiation. A lot of bad things that can happen just by being there. This is not talking about any disease process that happens, not talking about any traumatic injuries that happen. This is just the environment causing these problems. So, how we fix this? We're going to need some type of artificial environment. We're going to need to figure out some way of protecting some habitat that both personal and community based that can help withstand those insults to our body. Working out our limitations by duration of exposure. So how often do we start rotating people in and out? And we've already seen that if things go sideways, you could be up there for what, 9 months or so. And we need to be able to improve both of those. And a big blank space underneath because we're still figuring a lot of stuff out. We have a lot of habitats that we're doing on Earth, which gives us great simulations. But as we know, simulations can go a long way, but not all the way for letting us know the effects, both physiological and psychological. So, one possible future. Our new ISS is going to be a sponsored platform. So, we're going to have Elon Musk, we're going to have Bezos, we're going to have um, different countries having their modules. Now, whether they have separate independent um, structures or a combined structure that makes just this huge platform is still to be seen, because what what rule of law do we follow? It's doesn't fall under anybody's law. So once we start putting the private sector up there, it'd be interesting to see how they work out the social norms and social paradigms of that environment. We're going to see an increase in tourism because as they start doing this, the cost will come down, more people will go. And pretty soon, going to the ISS or going to the moon is going to be like taking a cruise. A moon base as a future launch pad to the Mars. And after there, who knows? But I think we're going to be surprised that it's probably going to happen sooner than we think. We already have Starship making multiple shots up. All of this getting ready for a planned future that we may not know all the parts on. We also have mining operation that can go on the moon, asteroids. As I mentioned before, the Mars mission, 9 months one way, and 3-year mission is what's on schedule right now that they're talking about. As I said before, Mars not on but in, because to me that just makes sense. And if you follow what Elon's been doing, he's been investing a lot in tunneling companies. Coincidence? Yeah, it could be, but I think we all know not. Um, they're all going to need a more robust healthcare system than what we currently have. And if we don't plan for it, we're going to have to throw it together last minute, and we're going to have people ill prepared for it. So our opportunities, shoot, they can be wide open, both on governmental and private sectors. It's really an unexplored area. They have an asteroid floating around out there that has more gold in it than there is on Earth. That's back up here. It's crazy to think some of the stuff that's going on there. So we have high level collaborations, and we're going to be getting some true interprofessional exchanges, because once you're isolated than that, we're only going to have each other. And let's face it, going to space is just cool. I dig that whole idea. So if they ever say, "Hey, Dr. Barnes, would you like to go in space?" Yes. Yes, I would. Send me now. I talk really fast, guys. So I am way open to questions. Nope. Okay.
Hey, greetings, sir. John from Chattanooga.
Yes, sir.
Uh, this is interesting, but like a year or two back, the Wilderness Medical Society did a program basically on the logistics. What type of stuff are we talking about bringing? Because the cost per pound was outrageous in terms of what they were bringing and what's practical and what's not practical. Can you comment on some of that?
Well, some of it is they're coming up with the ideas of using organic material that is on both the moon and Mars as building material. And that helped a lot of that cost. Now, sustainability like water, um, water's and oxygen or air are obviously your two largest things. And they're hoping that they find some form of ice or hydrogen and oxygen containing material so it can be generated. But quite honestly, that's going to be one of the key factors to try to make this work for any long-term settlement is how do you supply breathable atmosphere, water, food you can generally truck in and you can establish. I hate using the Martian as an example, but it kind of works. Establishing some type of either hydroponic or garden aspect where you can grow your own. Because eventually, unless you can self create sustainability, it's going to be real dependent on a very long supply chain. So yeah, logistics is still going to be the bottleneck on that.
A second comment on that, real quick, and I'll get off here. What would you bring? Because again, they were talking getting a pound from Earth to the moon was so much, but getting a pound of material from Earth to Mars was really. So, would you bring an AED? What medications would you bring? What things would you have to bring from Earth that you couldn't simulate in terms of and staying more in the medicine end of the world, not so much in the structure.
Yes, absolutely. Um, Definitely life-saving equipment. So you'd have to prioritize just as you would with any confined space logistical set. So yes, a AED, defibrillator, um, your code drugs, and then as you could start bringing in more supportive medications. But yeah, it's going to be, and I think that's one of the things that they're trying to work on is trying to figure out how to make the trips less expensive so they can afford to bring more payload out there. Because you're right, the more people you have out there, the more support equipment it's going to take, and the more. I mean, we're talking tons of support poundage uh, for a crew of let's say 100 people. You're talking tons of stuff. I don't know if that answered your question.
It's on the right track. Yeah, I was just impressed. The cost per pound almost made it prohibitive. What you could bring and how you had to really improvise.
Yeah, I think they're hoping that the cost per pound decreases with some of the advances that they're making, and now they're coming out with different propulsion systems that I'm just barely getting into the reading on, but they're trying to make it more affordable to launch more stuff up there. I mean, if you could put a satellite up there, you can put stuff up there, but yeah, it's going to be, and then how's it going to fare in those environments? You have to have them protected because these drugs can be very susceptible to ionizing radiation and changes in pressures and temperatures, of course, but that can be maintained a lot easier. But yeah, it's just having and storing is going to definitely be the probably the next largest hurdle because right now they're just looking at viability of transit. But yeah, they're going to have to start looking. In the military, we call it beans and bullets and band-aids. You're going to need all of those.
Dr. Barnes, I have a question in the chat. Has there been discussion over the nursing qualifications or experience in order to be considered for this kind of position?
They're not even looking at nurses yet. So what we're trying to do at A&M is to provide nurses in this program with the um, aerospace medicine information and knowledge so that they would have that background and knowledge to go in there. Right now, that's just about the best we can do because we're really they're not even thinking about it. They're not bringing it up. And studies on drug metabolism, I'm almost positive they are, but I can't remember what the outcomes of those have been. Um, I'm just looking at the ideas of if you've got to start a Foley catheter on somebody uh, in microgravity, how much fun that can be, or dealing with a wound or a fracture. Um, yeah, but just regular metabolism. Well, you know what? Let's see what Google has to say.
Right? Or what's the new AI for healthcare? Not Chat GPT, but like open evidence. I don't know. The only thing that comes to mind for me is like depending on what type of atmosphere you're in, because I'm sure it would affect you, say in like a scuba environment or something, is inhaled medications.
Right. Well,
Like
from what they're saying is that there's a rapid degradation of the medicine due to the ionizing radiation. And then you have the physiological changes in the astronauts that affect absorption. So the difference in the gut microbiome and um, just let's see. Yeah, so some of it is based on the drug, and the rest of it is just altered metabolism in the body. That's an awesome question.
Yeah, that was a big brain question. Nice job. Dawn says we had astronauts train at her hospital recently for chest tube insertion and CPR and how that will differ in space. So, not a
Yeah,
question. Actually, that's cool to know.
yeah,
Do you
it
know
really is. I mean,
anything about how that differs in space when you were training there?
well, I mean, the one thing is things are floating. And if you look at, you know, just physics, if I push in, I'm going to go backwards unless I'm wedged. So I'm going to have to be able to strap them down, strap me down, so that when I push forward, I don't send us both in opposite directions. Um, One of the aspects that we're looking at is the use of VR and a suspension system that will have the person doing it and as close to dry land weightlessness as we can. So you suspend them with counterbalance so they're floating, and then through VR, you're having them try to do these tasks. So if it works, it'll alert phenomenally. If it doesn't, we'll be like, well, crap, now what do we do?
Or I wonder if just because of this change in gravity, like if we're inserting a chest tube, we know where someone's lungs are laying. I mean, it's tight in there, but you know that they're laying more dependent because of gravity. So you're at more risk of like injuring the lung.
Oh yeah, yeah.
Maybe.
There is no down, so yeah, it'd be interesting to how the body, how your body is going to work with that. Because
Yeah.
if there is no down, everything goes everywhere.
Ooh, try it underwater. That's like most things. Yeah, that's what they seem to be
Yeah,
doing.
the neutral buoyancy lab they have at NASA is phenomenal, and it gives a very good representation of that buoyancy because they actually um, adjust weights and balances to make them literally neutral buoyant, so they can just sit there and float right where you put them.
Yeah. Vish makes a good point about changes in gravity affecting the vasculature. And I know a lot of medical studies that the astronauts perform on themselves in space and when they get back do have to do with effects of changes in their blood flow and if it causes early dementia, and also effects on the retina from changes in blood flow, obviously with like the vitreous humor in the eye too. But I don't.
Yeah. And Mr. Rajan, I am so with you. NBL would be my dream job. I'm trying to work my way. It's like, look, dude, just let me do one dive with you guys as an extra. But microgravity experiment on IUD and cannulation. That would be interesting. I'm going to copy that to see if I can't look that up.
Yeah, she did it with two other women. And they didn't do it in space, but like doing the zero gravity drops in airplanes. Um, John Fisher asks, how do you see pre-hospital providers such as firefighters, paramedics, rescue personnel being implemented into space travel and or colonization?
Yeah, I think the same way. If you have a station, say ISS or on the moon, let's just say the moon. So you got your moon base, and they're building a launch pad. Somebody gets hurt, you're going to have your paramedics and firefighter types going out, doing your first responder stuff, bringing them back into the controlled environment, and then the medical team would then move forward and pick them up. Um, yeah, definitely multi-trained individuals. So people that can go back and forth or be on call. Hey, you're going to be on responder duty. You're going to do um, house duty, and or you're going to be in backup.
Well,
So yeah,
sir,
having yes, sir.
yeah, my comment on that is, I'm going like the nurse comment earlier. Great individual, but unless she's got a doctorate in environmental engineering or some other mission critical purpose, primarily the nursing and medicals is almost going to have to be a secondary feature. Even a PhD physician, if he doesn't have a some other secondary career, he may not be worth the payload versus a physician who also has a background in, say, electrical engineering or some other bi-level or tri-level type multi-skills.
Right.
It ain't worth the payload, and I hate saying that way, but it's all
Yeah,
comes down to weight.
and I understand your point, and absolutely, it's more cost effective if yes they are also an electrical engineer, but very rarely you're going to have somebody that's going to have that specialty and medical. So, like when I was on teams overseas, yes, I was a shooter and a medic, but everyone understood that um, my full time job was that of medical. And we had other people that were just medical, and they were there, bored out of their skull most of the time, jumping out their wazoo, that other 10%.
Yeah,
Um,
but even there in combat, you had limited resources, but you still could get resources in a fast way, and you had time for downtime. Just take what you were using out there off a chopper and cut that down by a thousandth. That's all you got to use,
oh,
personnel
yeah.
and weight. And that's the issue I was always fascinated with.
Oh, absolutely. So, I mean, I did a lot of isolated type stuff where we didn't quite have that luxury of a good supply chain. And so, yeah, obviously, the more bang for the buck you can get, the better off you are. So, if you have somebody that's dual task, uh, I would like to have at least some people actually dedicated for medical. Now, whether they have a different job and they rotate out, that would probably be the best option. But I would want my medical people standing by, ready to go, just in case. Because holy cow, those EVA suits they got, it takes 10 minutes to get them out of that suit. That's crazy. Um, so they're gonna have to work on that. But I don't want have somebody come from a far end working on a platform to come down to medical with somebody's bleeding out. Uh, but I mean, you bring up a great point. If you're just looking at the cost benefit ratio, having somebody that can be multitask probably going to be the way to go.
Yeah, David C says, with the broad scope of practice needed in the physical requirements, do you see sourcing from personnel such as 18 deltas, PJs, etc.?
As a former SF guy, heck yeah, um, because they bring so much to the table, and you're looking at the ability to handle trauma as well as sniffles, flu, and cold. So, if you're a cardiothoracic surgeon, well, that's great. I can use you for one thing. But if you're a special ops medic or a really good internal medicine / ER, that's the kind of person I would personally want to pick.
And to me, you're missing the whole point also too. What if somebody dies up there? How do we bring it back, or do we bring it back, especially if there's a question of a viral problem?
Yeah, I would say repatriation absolutely would happen. Now, if it was a contamination issue, then we'd have to look at a lot of different things as far as the ability to fully decontaminate for whatever pathogen or was going on there. Um, Keeping in mind personal, religious, cultural um, ideas in there. Yeah, uh, definitely dealing with rains is one of those topics they're looking at. And right now, it's just freeze them, bring them back, um, and just literally run them as cargo at that point.
Not quite ready for at sea burials.
Hey, it worked on Star Trek. You know, you just put them in the launch tube and send them out. I wouldn't mind going out that way. But my luck, I'd get caught in somebody's gravity and get pulled back down.
And it wouldn't be much if you made it, or just launch me into the sun.
That's even better than the Viking funeral. Burn up on reentry? Yeah.
Does it get more metal than that? That might be the ultimate peak of human existence.
Yeah, yeah.
Tony in the chat, Fish asked, do you or does anyone else here tonight, because we seem to actually have a lot of astronaut knowledgeable people here tonight, know
Oh, I
if
love it.
there's a basic level of first response medical training that is given to or required of astronauts, like EMT level or anything?
I know that there's a given basic. I don't think it's actually certified as a EMT, but I think they are given a strong basic first aid um, type of a course. It could be like a TCCC, and then they have their. Usually, they'll have a doc on board, or have the ability to telemedicine down.
Yeah, it seems like this is purely from observation. I have no knowledge that there is always a medically trained personnel on the crew, or if it's a place where there's going to be multiple crews present, that there is within that larger combined body of people a medically trained person.
Yeah, Jonathan was mentioning about how they're pushing out care from fire departments and stuff. And this is just a rural healthcare model that we're going to have to embrace because we're not having enough physicians in these isolated remote locations. So that means other providers or other healthcare professionals are going to have to step up to the plate, whether that's PAs, MPs, advanced paramedic, critical care paramedics. They're just going to have to because what's your option? Somebody that's not trained trying to do their best.
I was kind of thinking about the metabolism thing earlier, and outside of just like how it affects in the human body, but another important thing that I has to be considered is just like how to get the drugs into people's bodies. Like you can't just have an IV drip depending on what gravity is or a drip rate,
Yeah, you'll have to have a pressure infuser or a mechanical pump just to
or
get it
even
in.
like everything that like you have to reconstitute to give. Like, will it stay in solution?
Yeah, great questions. Don't know. These
Dr.
are
Barnes, if you don't know, then how do we get these answers? Who does know? Because I
well,
guess
I
no.
guess, and there might
That's how
be.
I feel. How do you like? Yeah, the only way to study this is probably long term on the space station. You know, I'm sure it's been
Yeah,
studied in
because
class.
we haven't looked at ICU level care in microgravity yet.
Yeah, yeah. Truly, most of it has just been effects on how plants grow in a microgravity environment, and then like long term effects on the human body based on how long they've spent in space,
Right.
which could allude to medical care for long-term civilization, I guess.
Yeah, they're saying, just looking at, of course, Google, take it for what it is, that there is an issue with surface tension, capillary forces. You end up with foamy emulsions and bubbles because it's a non-natural mixing. So you have to have a modified reconstitution method. Um, so it's just injecting and agitating. So
Yeah, and Brittany brings up a good point about atmospheric effects on medications and supply use. So again, those partial pressures and whatnot. So like, what's drug storage look like in space? Now we need like an astronaut or someone who's been on the ISS to tell us like, what do they keep up there and what does it look like and is it as we
absolutely.
normally
Do
see
you
it?
keep it in liquid form, or do you have everything in an powdered crystalline form so that you can then reconstitute it and then deal with, however you reconstitute it?
Vish says you can't take light sensitive medications. What? That
Well, if they're UV and there's no protection whatsoever, so you would have to just protect everything. And if they are UV sensitive, um, yeah, you'd have to figure almost like a dark room for reconstitution.
oh wow.
Mind blowing, isn't it?
Yeah.
So here's a good recommendation, and I love getting into entertainment media for inspiration and answers. The Endurance book series. Yeah, raising blood pressures when you have an almost global vasodilatation because you don't have the compression unless you put them in some type of compression suit to try to mimic that 14.7 psi.
That's another real big brain thought. I'm always impressed by this group of people. Man.
You, you get more intelligent people looking at things, you come up with more questions and answers initially. Then you start coming up with some awesome answers.
Yeah, Vish, revival of the pneumatic shock garment.
Yeah, there's G suits for a reason. So if you had them in an actual suit that we could pressurize and then isolate out so that you could work on a limb while the rest of the body is being compressed. All right, any engineers out there, start working on it.
Yeah. Feel free to come off mute, you guys. Say hi to your homies that you catch up with here every month. Chat with Glenn Barnes. Also, he's a wealth of information in case you haven't noticed. If you have any questions about how to pursue your FAWM, about any of Dr. Barnes' past experiences in the military and global response, and I don't know, I feel like you can come up with it and he can bless you with some knowledge. Feel free, ask away.
Well, Dr.
Hey,
Barnes, you
no
probably
pressure.
have some experience dealing with what I would think would be very close people doing saturation diving. If the diver in the suit gets sick, you you can't help him.
Yeah,
The same
and
way the
that's why.
spacesuit, if he gets sick in the suit, you can't touch him. You can't take him out of the suit because where you're at. Maybe if you're in a
Right.
capsule or a habitat, yeah, I could work on him in a habitat. But man, I can't
Yeah,
imagine him getting sick in suit or injured in suit.
yeah, or a bleed or something like that. I was thinking either a type of quickly deployable microenvironment, kind of like they do for the inflatable hyperbaric.
Yeah, the Maslow, Maslow tube, or what they call that thing. Yeah.
Yeah. So something you could rapidly deploy, put in, and pressurize so that it would have to be large enough for the patient and a provider to get into and create a micro environment right there to get them out of that suit. And again, right now, suit extract is 10 minutes. At least that's what
It's
they told me in NASA, and I'm like, well, crap, that's not going to do good.
SAT divers have a deck decompression chamber, which you have 5 minutes. Oh yeah, the SOS hyperlight is perfect, but it's only one. You have a multi-place SOS as well. The hyperlight is only for one person.
It would be
But
the most the smallest one and the easier one to deploy, but there are transfer
yep,
on pressure protocols for those. Sorry for interrupting. I work at DAM.
No, no,
oh
no.
yeah, that's brilliant. The SOS is amazing, and SAT divers have a 5 minute transfer time from coming to surface to going to the deck diving chamber, which I'm sure you're aware, Diana. And but that gives them a few minutes. I think it's probably similar to uh, astronauts as well. Only thing, the pressure is going to be slightly more negative, I guess.
Yeah, I'm still learning about I just got my advanced, so I'm just now ready to start getting into the more technical side, so I can learn about the saturation diving, the rebreathers, and all that other good stuff. Um, because they all are going to come with their own unique environmental challenges for a care provider.
Yeah, I mean, I have a rebreather and I'm a DMT, so
Nice.
pretty much my ballpark, my playground.
You should hit me up and we start doing this course in the fall of next year.
Yes, I will. I should be in Texas around that time as well.
Oh,
So, yep.
please drop me a line and we'll link up.
Vish, you are literally all over the world doing everything that could be done also at all times. Like, I don't know how you do it.
That's
Vish was
true.
literally just in Grand Junction, Colorado.
Yep, that was a week of 3 to 4 days ago. I'm back in Texas. I'm heading to Malta on Friday. Yep, fun stuff.
Yeah. And Jonathan brought up a good deal is having to do these tasks when you're in a suit. You know, it's like finding a deployable microenvironment that you can actually deploy and take care of in a suit. So, I mean, that just increased the size of this microenvironment tenfold.
Yeah, it's kind of like if you remember the CBRN classes which you did, and you had to deploy the auto injectors while still
Yeah.
in that suit,
Yes.
extricate, and yep, the good old days.
Yeah. I'm thinking we're going to end up having to have some kind of medication access port that you can access and then deliver stuff. I don't know, or aerosolized meds and just have them breathe everything.
Maybe patches even.
Yeah.
We could just have like maybe have a quick zipper taken off on a suit. I mean, half arm or something. Throw the patch, and you're good to go.
Yeah. Yeah. Man, you know, we keep coming up with all these deals that other people, I'm sure, are scratching their head because it's their job to figure that out, or they haven't even thought of it. It's amazing the amount when we start looking at some of the aerospace stuff. They were doing this experiment on. It was a tilt table tilted at a -6 degrees to simulate the effects of microgravity on internal organs, and they wanted people to lay in this bed for 24 hours and they were looking at tilt tests and things like that. And we're like, okay, well, how are they going to pee? They never even considered that these people in a 24-hour period would have to go to the bathroom. Yeah. And it was the nurse that brought it up. Not me, another nurse, but good on them.
Wasn't it something with NASA or space that they tried to send a female astronaut with what was it, like 500 tampons because they didn't know how many tampons a woman would use in like a very short trip or something like that. It cracked me up.
Yeah, I
Yeah,
mean, as weird as it sounds, it's stuff you got to know because you're going to have women of childbearing age, then those things happen. And so You either prepare for it or get surprised by it.
Was when Sally Ride flew, the first American female astronaut.
What was that, Martina?
This is the story about the tampons comes from when Sally Ride, the first female astronaut, flew to space.
Oh, wow.
Yeah, 500. Sorry.
It's interesting that like engineers did not talk to her. They just like did their own estimate.
Anna dropped in the chat a great paper discussing women's health in space. Thank you, Anna. That's a great resource.
Would you consider, similarities between, dive medicine with space medicine yourself?
I would. We're looking at, and we've combined those two in our program because you're dealing with pressure and you're dealing with breathable atmosphere in both of those situations. Now they're polar opposite, but it's kind of like putting desert and jungle together. They're both hot. One's dry and one's wet. So yeah, we have to look at the barrel pressure and creating an artificial breathable environment for that person. So yeah, absolutely. I 100% agree with you on that.
It's crazy. And the reason why I ask you is because I was in the last UHMS, that's the Undersea Hyperbaric Medical Society conference, and there was a group to try and bring consensus with aerospace, aerospace medicine or something like that. I wasn't there, but I heard about it, and some people having mixed opinions about bringing those two together. So
Yeah, people are proud of their silos, unfortunately. And until we get over ourselves and realize that we can work together and we can share information, we are going to have those kinds of struggles. Um,
Yeah,
it's sad.
I had in my DMT class, we had Dr. Bob Sanders teaching the class. I mean, co-teaching the class, and he's a aerospace doc, and he's a UHMS fellow. And we had three docs, I think from UT as well, Dr. Barnes, I'm not sure. Three of them who were pursuing aerospace medicine, who had come in to do the dive medicine, the DMT program. And personally, having dived for a while and studied a little bit about flight medicine, huge correlation in terms of physiology, if not the neutral buoyancy aspect of doing stuff when you're in space and trying to figure out how to do stuff underwater.
You're right. Now that I remember, so working on the hotline, we have been listed in the FAA, in some FAA material to call us for, I suppose,
Rapid decompression, yes.
Yeah. And I've dealt with a couple of cases, but I find it extremely interesting. Just for a full disclosure, I was more of a austere environments towards, tropical medicine until I started diving, and I got certified in Thailand like in 2005, 2000, yeah, 2007 actually. My bad, 2007. And now obviously working at that, I'm more saturated with the whole dive medicine and taking calls from physicians and from lay persons, and having to be up to date with everything it's been an interesting journey. And I feel like even though we see a lot of patterns that are pretty textbook, when we get these calls from the FAA or people from flight medicine or things that I have no idea about, it's a huge learning path. Takes the entire dedication of a life to learning medicine, I suppose, right?
Absolutely. Um, And that's part of the reason I like you, I'm a huge fan of diving, and then I love to see more divers in there. Uh, yeah, it is just, and I do want to find out more about the saturation diving. I want to hit Martina here, she pulled up the article, and I just read the same thing, and it galled me. It was like wanted to figure out what kind of makeup they wanted them to wear or to take, makeup kit they wanted them to take. I'd be like, have you lost your mind? And 100 tampons? I'm sorry. If you changed out 99 tampons, you're probably dead. You don't have enough circulating blood.
Well, it's also interesting that like she flew there just for a week, right? So it depends on a week. Maybe she needed 0, right?
Right. It should have been like, no, I'm good. And I would have probably said, hey, take 4 or 5 just in case. Because we didn't understand the effects that would have. And speaking of effects, someone had brought up about reproductive. There's a group out there that deals with space sex. Now, because when you say space sex, people lose their freaking mind in academia. So I was not allowed to talk to these folks on a serious level. But once we get over our prudishness, I definitely want to bring them into this, because if we're going to talk about generational missions, we absolutely are going to have to talk about SpaceX. And we are going to have to talk about what's going to happen to a gestating fetus with those exposures. Can we protect that fetus from those exposures? How is microgravity going to affect a fetus? How is microgravity going to affect a infant if it never knows down? How will it learn to walk? We are going to have to figure our artificial gravity flat out. And right now, the best option they have is to spin something so freaking fast that if you're on the edge of it, you're going to have centrifugal force pulling you down. That's our best bet right now. But until we can induce an artificial gravity, we are going to limit ourselves to adults short term, because anything other than that, we can't fix what's going to happen to them, and they'd almost never be able to come back to Earth because the gravitational force would just crush them. So I don't know. It's I'd like to say
Effectively
that
creating
that's
a new species, you know?
Yeah, the whole ethics of it, the whole concept of are you going to would how do you it's going to be a huge question. That's another story
yeah.
altogether, I guess.
And I'm sorry if we don't have a paper somewhere that shows what happens when people bump uglies in space. I'm not sure if we can get a research project on that one or not, but
I'm thinking of the embolisms.
you know,
That's
um,
possible.
yeah, that's possible. And Lord help if you ever start looking at delivery. There's just so much for a multi-generational. It cannot happen unless we get some type of artificial gravity. Just can't. Too many risks. Now we can block against ionizing radiation. We can work with pressure gradients. We can't get away from the lack of gravity. This has been cool.